Yes. Hi, everyone. Thank you for joining this webinar on sex work and HIV in Europe, Which Way Forward for Community Leadership, which is co-hosted by ICRSE and EU Civil Society Forum on HIV, Hepatitis and Tuberculosis. I'm Jules James, sex worker and the new health officer of ICRSE, and I will be facilitating this meeting today. So just a bit about ICRSE. I think most of you know ICRSE, but ICRSE is the International Committee on the Rights of Sex Workers in Europe. And it's a sex worker-led network that represents 1,100 organizations led by or working with sex workers in 35 countries in Europe and Central Asia. And the core aim of ICRSE is to ensure that the voices of sex workers in the region are heard, listened to, and respected. So about the report that we are launching today, it's a resource that was developed as part of the European Red Umbrella Academy Sex Work and HIV Training Program that was developed in cooperation between ICRSE and EATG, the European AIDS Treatment Group, and that is financially supported by Gilead Science. The program had two main objectives: to strengthen the partnerships between sex workers and HIV activists, and to build their capacity to advocate for the inclusion of sex workers in HIV and public health responses at the national and international level through the development of several resources, such as the briefing papers and the videos. So today we are launching this report. You can find it online on the website of ICRSE. And we are very excited to have a lot of fantastic speakers with us today, both experienced on a local, regional, and international level, that are advocating for the rights of sex workers or are providing sex workers services to sex workers. And then after that, we will have sometimes time for the questions from the audience. For the speakers, because we have quite a long list of speakers, I will remind you that you have around 5 minutes to speak. And once the 5 minutes are over, I will gently ask you to wrap up. Otherwise, we won't have time for the questions. So I would like to give now the word to Dr. Tlalong Mokofong, who is the UN Special Rapporteur on the right to health. And Dr. T is a medical doctor from South Africa that is advocating for universal health access, HIV care, sexual and reproductive health rights, and gender equality.
Кой е експерт за сексуално и репродуктивно здраве?
Thank you very much, colleagues, and thank you very much for this invitation. Like you said, I am a medical doctor and I'm still in clinical practice. And this is how initially in my young career as a medical intern, I started to come face to face with the realities of sex work and the different challenges that sex workers face in the workplace. And I've always maintained that, sex work is work, and guided by the International Organization, that defined sex work as work as early as the 1970s. And it's from that I drew my approach to sex work and to how I have become a clinician, first and foremost, who offers services and clinical care to sex workers, and understanding that sex work is an occupation, and therefore there are some occupational health information that sex workers require. And I must say, living in South Africa, we are always grappling with the negative, inhumane impacts of continued criminalization. And we know that even when you are talking about people in, for example, in the criminalized setting, there's only so much that can be done, that can be explored, that can be developed in terms of sex work and sex workers. And so my view has always been, even though I'm in public health, not to view sex workers as, people who need to only be spoken to through the narrow lanes of HIV or STIs or communicable diseases, but to offer holistic support for sex workers. And decriminalization, for me, is a very important element and a very key area of focus in terms of removing punitive laws and removing punishment of adults who are able to negotiate consensual sex. And safer sex tools become important. And in South Africa, one of the biggest inhumane practices is that because of criminalization, you have compounding effects and an enabling environment where even police officers are confiscating condoms, right, from people who they believe are sex workers. And the police also may treat the fact that a person is carrying condoms as some form of evidence that they are a sex worker, and therefore arrest them arbitrarily. And of course, this in literal terms means that, sex workers are less likely or a bit discouraged to carry safer sex tools in case they become profiled, by police. And we know what it means then in terms of increased risk of having unprotected sex that may lead to acquisition of sexually transmitted infections, which include HIV, hepatitis, herpes, and other important STIs. For me, I think human rights as a framework is an important guiding framework, because it acknowledges the fact that regardless of one's occupation, gender, class, race, geographical location, issues of migration, right, where even in South Africa we see a lot of migrant sex workers, that everyone at the end of the day should be guaranteed their human rights. And it's very clear that when you use a human rights approach, when you're talking about sex work and sex workers and the issues that intersect in the space, that states have certain obligations to respect, fulfill, and to protect human rights. And I particularly take the view and use the framework of human rights as a guide because it removes the issue of morality or religiosity on the issue and really talks about the vulnerable situations that sex workers find themselves in, the rights abuses and the rights violations, and locates that within a framework where justice can be sought. Because when you are using morals or religion or culture, it's very difficult to then demand justice because the yardstick keeps moving, the goalpost keeps moving. But human rights as a framework gives us that very clear principles and ideals that all of us must be adhering to. And decriminalization is supported by other UN agencies like UNAIDS, the World Health Organization, and we have other organizations that also support using evidence, the call for decriminalization. I think that's what's really important, again, when you're talking about, in the space, right, of rights protections, that the health sector is one such important sector. But criminalization means that even in the legal system, sex workers face prejudice. Even in the financial sector, sex workers face prejudice. And so you have this compounding and intersectional type oppressions that happen. And I'm a feminist, and as a feminist, I believe that sex work is work, and I believe always in the affirmation of agency of women and those who choose to do sex work. And I, for many years, have been outspoken as a supporter of decriminalization. And I think what we've seen in terms of COVID-19 and the impact of COVID-19 on communities that were already vulnerable before the pandemic, we've learned, and many of us could have predicted this, that the fallout and the impact of COVID-19 will be felt mostly by those who were already at the margins of society, who were already being cut out of civic services, from access to healthcare, from information, from justice in general. And I will stop here because I know that we'll be interacting, with other panelists later. But I think there is a lot that can be said about the movement on the ground and how even in South Africa, there's been, consistent call for decriminalization, and how that advocacy work, has really looked in this time of COVID, but also looking forward. How do we assist each other across different regions of the world to advocate for decriminalization? But absolutely, I think sex workers have been let down by many public health systems, and the only way to improve that is to use a human rights-based approach, both to sex work and sex workers and their rights, but also in terms of public health as we know it. Thank you very much.
Thank you, Dr. T. I agree very much with you. Thank you for your words. And now I would like to welcome Emily Christie, who is the Senior Advisor for Human Rights and Law at UNAIDS, the Secretariat to the Joint Program of HIV and AIDS. And Emily works extensively on the rights of key populations and vulnerable groups, and on the development of policy and guidance. So Emily, you can speak.
Thank you very much, Jules. And I should just begin by saying I agree with everything that Dr. T said. It was fantastic. And it's great to hear a really strong advocacy line around the issue of criminalisation and the need for decriminalisation. So thank you for that. I really just want to start with, I guess, overarching thesis of what I'm going to be talking about, just to have a summary at the beginning so we know where we're going, which is that, as we know, sex workers are disproportionately impacted by HIV with higher risks and lower access to services. We know that this is due primarily to societal barriers such as stigma, discrimination, criminalisation and inequalities that really create these barriers to prevention and care and prevent scale-up of community-led services and advocacy as well. And if we don't tackle these societal barriers and have a human rights-based approach, as Dr. T has said, we really are not going to be able to progress on HIV. And so moving into some of the data that we have now around this, last year UNAIDS reported that for sex workers, the risk of acquiring HIV is 30 times higher than for the remaining population. And around 8% of new adult HIV infections globally are among sex workers. Generally, if we go to a national level, we don't always have a huge amount of data, which is one of the issues with vulnerable and marginalised populations, is that people just don't get counted, people become invisible. From the data that we do have in Europe, prevalence of HIV amongst sex workers ranges widely from 0.3% in some countries to 11% in others. But even that data hides significant inequalities between groups. If we look at transgender sex workers, it can actually be up to 20%. If we look at migrant sex workers, it's higher as well. And so really digging into some of that data and those inequalities is quite important. Globally, the progress has also been different. Since 2010, rates of new HIV infections have decreased by 23%. But for sex workers, they've barely changed. Close to a third of sex workers don't know their HIV status, compared to 19% generally. And where we have data, we know in general that access to HIV services is worse for sex workers than for others. Sex workers who are migrants, transgender, sex workers who use drugs, from racial or ethnic minority groups, they all face higher risks of HIV and lower rates of access as well. There was a recent evidence review on HIV and migration, actually in Europe, that demonstrated there's a clear distinction between migrants and nationals in terms of HIV burden. If we looked at sub-Saharan African migrants, the HIV prevalence was 14%, and actually 30 to 40% of that was post-migration HIV acquisition. It's interesting because Europe as a region is leading in the progress against ending AIDS and managing to obtain the targets. And for many countries, ending AIDS as a public health threat is actually within reach. But even when there's high coverage of affordable services, these entrenched inequalities and vulnerabilities constitute barriers to ending the epidemic for particular groups. What's very frustrating is, as we've heard, we know the causes and the solutions of these inequalities. HIV is entirely preventable, as are AIDS-related deaths. We know that criminalisation of sex work, including criminalisation of clients, increases the risk of sex workers acquiring HIV and their vulnerability to violence perpetrated by clients, police, and other third parties. We know that decriminalisation could avert between 33 and 46% of new HIV infections amongst sex workers and their clients over 10 years. In 2018, the Global Commission on HIV and the Law reviewed recent evidence on the impact of end demand models in Europe and recommended governments should refrain from adopting laws based on this end demand model of sex work control. We also know that community-led services lead to better health outcomes for sex workers. And these two are connected, the criminalisation and community-led service delivery, because with criminalisation, it impacts on that service delivery and the ability for people to provide services, to register organisations, to raise funds. So a study last year actually in Canada found a 23% reduction in access to community-led services in an area that had introduced end demand models. So we need to invest in people-centered, community-driven approaches to HIV. We need to remove punitive and discriminatory laws, and we need to remove other legal, regulatory, and financial barriers, such as out-of-pocket expenditure for ART, for people using PrEP, and to really make it easier for people who are migrants, who might be undocumented, who are from other minority groups, to be able to access services. And I quickly wanted to talk to you about the new global AIDS strategy. It was developed over the course of the last year. It was a consultative process with over 10,000 stakeholders from 160 different countries. And it was developed not just as a global AIDS strategy for UNAIDS and for the UN, but for everyone. Because of the nature of the extensive consultation processes, this really is to be informing the steps over the next 5 years. And what we've just talked about really is seen and reflected in the new strategy. We look at the targets, and these are available online. There are incredibly ambitious, but hopefully attainable targets around these societal enablers. So this is that less than 10% of countries ultimately will criminalise any aspect of sex work. Less than 10% of sex workers will lack access to justice. And less than 10% will report experiencing stigma and discrimination or negative attitudes from health workers and law enforcement. We also have a target on violence with the hope that after 5 years, less than 10% of sex workers will experience physical or sexual violence. It should be 0, but this is a stepping stone to get there. And these are then linked with targets that we have on community-led organisations, which is that 30% of testing and treatment programs should be delivered by community-led organisations. 80% of prevention programs for key populations, which include sex workers, should be community-led. And 60% of programs for societal enabler change should be delivered by community-led organisations. 2 final things, and then I'll hand back over, which is that on the 31st of March, the UN Secretary General released his report on HIV. And in it, he urged member states to remove punitive and discriminatory laws, including those that criminalise sex work. And he noted specifically that repressive laws regarding sex work are linked to higher rates of HIV. And then finally, it might be interesting to know that we have a high-level meeting coming up for the UN on the 8th to the 10th of June. And this is where the new political declaration on HIV will be negotiated and finalised that will outline the commitments that countries have made for the next 5 years. The 0 draft is now out. It's publicly available, and it currently has specific obligations relating to sex work, including ones on violence, on removing punitive and discriminatory laws, and ensuring access to services. So I would urge you all to go and have a look at that, as well as having a look at our strategy, and then we can see how we can strengthen these and move forward in the next few years. Thank you.
Thank you, Emily. And yeah, maybe later I can post a link to the strategy as well, the draft, for everyone to be able to look at it. Thank you for your words. And now I'm gonna give the word to our next speaker, who is Lila Milik. She's an activist for the rights of sex workers and transgender people in Macedonia, and she will speak about the work of STAR, the first sex workers collective in the Balkans. And she will speak in Macedonian, and Bojan will translate. So I hope it's going to work out.
Здраво на сите.
Hello everybody.
Благодарам на поканата за участие в вебинар. Јас сум Лила Милик,
трансгендерна I'm a transgender sex worker.
Доаѓам од Македонија.
I live in North Macedonia.
Работам во Star првиот
колектив на сексуални работници на Балкан.
Star е формирана 2010 година.
Back in 2010.
Работиме на 3 програми.
Програми за
програми за здравје, за превенција и програми за развој и одржлив развој и градење на капацитети.
Gender development and capacity building.
Денеска ќе се задржам на тоа што организација направивме во минатата година.
What we have done as an organization throughout the last year while the COVID-19 pandemic was in place.
Сите знаеме, мислам, цел свет ја погоди
пандемија. We all know that everybody was infected by this pandemic.
Ако може само презентацијата да ми ја пушташ.
Would you please share my presentation so that I can guide everybody through it? There it is. Yeah, пуштаме.
Ја видов. Значи, влијанието на
COVID-19
имаше импакт врз социоекономските,
has had impact on the socio-economic,
кон здравствената, менталната и правната благосостојба на сексуалните работници. Сексуалните работници највеќе беа погодени, тоест имаа потешкоти во пристап до храна и финансиски средства. Квалитетот на животот им беше доста намален.
Life has been significantly reduced.
И потоа немаа доволен пристап до HIV тестирање, немаа доволен пристап до
insufficient access to HIV tests and services.
За сексуално преносливи инфекции и нема едноставно пристап до здравствени услуги.
And there was a lack of access to healthcare services in general.
Бидејќи сите државни клиники, јавни клиники беа претворени во
healthcare institutions have been turned into COVID-19 centers.
И од тука имаше потешкоти до сите здравствени услуги.
There were hindrances when it came to access to healthcare services which are rather necessary for sex workers.
Исто така, поради намалувањето на работата, поради намалувањето на клиентите на сексуалните работници,
reduced volume of work within the sex workers community.
Има потешкоти во однос на плаќањето на нивните режиски трошоци и месечни такиви.
There were difficulties when it came to covering their daily expenses and paying for their rent.
Од тука Star како организација,
which is why Star as an organization,
во март, од кога почна пандемијата, отвори донацијска сметка.
When the pandemic emerged, we opened a donations account.
Каде што можеа да донираат лица и од Македонија, но и лица од целиот свет.
Donate locally and internationally.
Каде што тие средства беа наменети токму за помош за сексуалните
работници. All the finances were targeted specifically for sex workers.
Покрај донацијската сметка, Star направи и донацијска аукција,
has already made a donation, organized the donations auction,
која што ја започнавме символично на 2 јуни на меѓународниот ден на сексуалните работници.
On the 2nd of June, which was the International Sex Workers Day.
Каде што повикавме реномирани уметници, модни дизајнери,
renowned artists, fashion designers, photographers.
да донираат свој дел,
to donate and contribute with their works.
И аукцијата идеше по принципот кој повеќе даде пари, тој го добива делот.
And the auction was organized in terms of the highest bidder acquires the work which was offered.
Исто така, исто покрај донациската сметка и донациската аукција стар
apart from the donation account
хуманитарни аукции,
there were 8 additional humanitarian auctions,
каде што не само на сексуални работници од Скопје, туку и на сексуални работници од Гостивар и од Струмица,
for which not only sex workers living in Skopje, the capital city, but also in 2 other cities from the country,
им помогна со хуманитарни пакети,
were helped with humanitarian packages, personal protection equipment,
и за заштита од COVID-19,
that would help them protect themselves against COVID-19.
Покрај хуманитарните акции отворивме и инфолинија.
Humanitarian actions, we've also opened an info line,
каде што сексуалните работници можеа да ги дознаваат, тоа сексуалните работници можеа да знаат, да ги знаат нивните права, да знаат како да се заштитат од COVID-19.
Sex workers could learn about their rights and also could receive guidelines in terms of how to protect themselves against COVID-19.
Исто така државата до овој период имаше 6 пакет економски мерки.
The government has offered 6 packages of economic measures to tackle the pandemic.
Каде што во ниедна мерка не беа опфатени сексуалните работници.
However, sex workers were not covered in any of them.
Па од тука дојдовме на идејата да
which is why we came up with the idea
да вклучиме и социјален работник и параправник,
to include a social worker and a paralegal.
Каде што социјалниот работник за време на пандемијата во 2020 година,
in which the social worker during the pandemic in 2020
има возможи на над 20 сексуални работници,
provided services for 20 sex workers,
да се ги остварат своите социјални права во однос на социјална заштита,
to their social welfare entitlements,
да добијат финансиска парична поддршка од тој социјално од страна на државата,
to have access to financial aid enabled by the government.
И на еден сексуален работник му беше овозможено да државата му ги плаќа месечните трошоци околу неговата кирија и режиските трошоци.
And for one sex worker, even the government, the state institutions covered their rent, their monthly rent. And
да не беше социјалниот работник.
Incurring expenses.
Да не беше социјалниот работник, сексуалните работници немаше да ги остварат своите права.
If it wasn't for the social worker, the sex workers would have never been able to these rights. They wouldn't have access to them.
Параправникот служеше како линк помеѓу организациите и социјалниот и правниот сервис.
The paralegal was in actual fact a link between the civil sector and the state legal institutions.
Каде што ради пандемијата, многу сексуални работници беа затворени дома и трпеа семејно насилство.
Due to the pandemic, many sex workers have been isolated at home and subjected to family violence.
И така да улогата на параправникот беше да ги мотивира сексуалните работници да ги продолжуваат постапките до крај.
So the role of the paralegal was to encourage sex workers to actually report the violence and seek justice.
Исто така имавме изработено и 4 лифлети кои што беа делени помеѓу сексуалните работници.
We have also made 4 leaflets which were distributed amongst sex workers.
Лифлетите беа насочени кон како да се заштитат од ХИВ, да ги препознаат своите права во однос со полиција, информации во однос на социјалната помош.
protection against HIV and access to social services.
Што се однесува до третманот за ХИВ за време на пандемијата, како што спомнав, сите клиники беа претворени во ковид центри. Па од тука граѓанските организации нудеа стационарно ХИВ тестирање. Бидејќи 2 месеци беше отежнат и пристапот до мобилното комбе кое што го нудат организациите за ХИВ тестирање.
Given that within a 2-month period, the mobile HIV testing was put to a halt.
Од тука нашите клиенти ги препраќавме да се тестираат во стационарните центри на организациите.
We have referred our clients to go and seek stationary HIV testing within the civil sector organizations.
Исто така сакам да напоменам дека во последните 10 години сме единствените сексуални работници во Македонија кои што се уклучени како ХИВ советувачи.
I would also like to point out that we are the only, within the last 10 years, we are the only sex workers that come from the community, and we're in actual fact HIV testing counselors.
Во 2020 имавме плюс уште две трансродови лица, едниот трансродов сексуален работник, другиот несексуален работник кој што се вклучија во ХИВ советувачите.
And in 2020 we've had an addition of 2 sex workers, one transgender sex worker and another transgender non-sex worker who have become HIV testing counselors.
Што се однесува до терапијата која што е потребна за ХИВ позитивните лица, сакам да напоменам дека немаше никаков недостаток.
ART, there was absolutely no lack of it throughout the pandemic.
Организација која што работи со лица кои што живеат со ХИВ,
an NGO that works with people living with HIV.
Го овозможи достапноста на терапијата и покрај тоа што има луѓе кои што живеат надвор од Скопје.
Enabled the accessibility of the therapy, even though there are people living with HIV who do not live in Skopje.
Нивната терапија беше праќана по пошта.
The therapy for these individuals was delivered by mail.
И на нешто што ни е онака посебно значајно.
Something of great importance.
Тоа е дека од кога постои СТАР од 2010 година до денеска.
STAR has been established back in 2010 to this day.
Немаме ни еден ХИВ позитивен сексуален работник.
We haven't had any sex workers testing positive to HIV.
А тоа е благодарение на едукацијата која што ја нудиме како организација.
For the most part, thanks to the education we offer as part of our day-to-day engagement.
На превенцијата која што ја нудиме како организација.
Prevention which we offer as an organization.
И на градењето на капацитетите кај сексуалните работници.
And capacity building within the sex workers community. Lila ми кажува дека се поминати се.
Готово толку.
Yeah. All right. Lila has finished officially.
Lila, are you finished?
Yes.
Yes, thank you very much. And thank you for your presentation. And thank you for your presentation as well. I think, yes. So our next speaker is... wait, before that, I think, Bojan, we still hear you. So if we are in German, we still hear Bojan speaking. So now... English, yeah. Okay, for everyone, go back to English. So our next speaker is Lia Jawad from Trans United Europe. Lia is a Lebanese trans person and a professional psychosocial support worker who is certified music therapist, and she holds a bachelor in theatrical arts. Lia, please go ahead.
Yes, thank you for handling the microphone. Well, first, let me start by introducing Trans United Europe for those who are not aware of who we are. As an organization, we work in basically operating for trans BIPOC, Black people and people of color who are residing in Europe. We started in 2013 here in the Netherlands with Trans United Netherlands, and we formatted in Brussels the umbrella of our network, Trans United Europe Network. Basically, our work is dedicated for sex workers, and specifically trans people and trans sex workers specifically. And we are an organization who are community-led organization. We are sex workers ourselves and people living with HIV ourselves, and trans persons also, helping the community directly. We work on 3 domains. First, sex work and the decriminalization of the sex work. The second, the trans-specific healthcare with policy advice and lobby around implementation of WHO ICD-11 on gender incongruency. And we also work on HIV activism centered around the trans people of color perspectives and narratives, HIV activism on inclusivity of gender non-conforming, non-binary, and trans men. What we do exactly on ground is that we provide policy advice about trans issues, activism for legal changes for trans people of color, inclusion in the anti-racism debates, organize of events according to the trans calendars such as TDOR and HIV Trans Day. In the Netherlands here, trans sex work activism and outreach. We implement safe spaces and cooperate with social workers, lawyers, police, mental health givers, caregivers, all that. And the very first thing that is important to state is that our safe space that is residing in the heart of Amsterdam, that I'm going to be talking about in a while. First, let me talk about Trans United and HIV prevention. Our method of prevention started as just like installing the Trans United clinic for trans persons to come and do general blood testings when it's needed, STI and HIV testing, also offering or easy access to PEP and PrEP, and also direct links with hospitals and gender clinic in Amsterdam. As been said, we follow the ICD-11 protocols guidelines by WHO on gender incongruence. We work holistic and provide prescriptions for hormone therapy. We provide STI and HIV tests and care, and cooperate with hospitals to ensure direct possibilities for redirections to startup therapies. We redirect to PNG 292, the sexual health clinic in Amsterdam, with whom we work very closely. GGD Amsterdam also. Consultations, we offer consultations with doctors, and it's possible to get a self-paid prescription that you can use on regular pharmacies. All medical contacts are done by GGD, by collaboration between us and GGD here in Amsterdam. First, gender affirming and non-discriminatory care, hormone therapy, blood tests, as we said, mental health care, also special care for trans people with disabilities, personal care such as nutrition, safety issues, housing, HIV support and counseling, community care and well-being. People may have problems with drugs and specific sex support. We offered our safe space in Amsterdam, and we call it the Tea House. The Tea House. In the Tea House, actually, it's an open space for anyone, for all sex workers and the transgender people to come and spend some time in there, They meet new people from the community. We offer in the tea house legal advice for trans persons. We can also contact a lawyer in case any sex worker or transgender people having trouble with legal issues. We also do referrals, as we said, to Pay and Khif for HIV testing and sexual health consultations, and also to start the hormones. We can do an appointment with the doctor to start for trans persons to start their hormones or share their concerns about it. As a success, actually, lately we are being able to provide our beneficiaries safe space, as you said, in Amsterdam. The medical care. Let me repeat them: as we start hormone therapy, STI screening, HIV testing, talk with a doctor about sexual health concerns, and talk to a social worker for social protection when needed. Legal support for people of color residing in Netherlands with or without a permit, organizing events and opportunities to spread awareness and knowledge about HIV prevention, testing, and medication. Also, moving to the challenges that are being faced with the work, basically. When it comes to sex work, there are a lot of policies that are still they are not helping sex workers to practice their work properly. We have less possible access to formal or public medical care because of the criminalization and discrimination and stigma around sex work and trans persons, which is leading also to less insurance companies to accept sex workers as a client. And we all know the drill here, which is less access to medical care means a high risk to have HIV or to even take care of yourself when it comes to sexual health. Homelessness, one of the challenges that are really on the top of the shelf is homelessness and housing issue, where it's not allowed to a person carrying a sex work license to own a house, for example, and owning a license for people of color is even harder. Yes, my time is up. I'm sorry. It's okay. Last thing, I just if I can only say what the last thing that is really puzzling for sex work workers, which is like each city here in the Netherlands has its own possibility, which is putting the sex worker in a dazzle around, like if they move to a different city to know the new policies and so on. Even the control is being so harsh that sometimes control is coming to the person's house in order to criminalize them, to tell them that you're doing something wrong, and where they are just practicing their right to work. Thank you.
Thank you, Leah. Thank you for talking to us about Trans United and the situation in the Netherlands, which is not ideal, contrary to what people think. Now I will give the word to Kate. So Kate McGrew is a performing artist and a sex worker and a co-convener of ICRSE. And she's the director of Sex Workers Alliance Ireland, SWI. And she has a new show, Horrorcore, and she's currently contracted to write a novel to be published with Merci Presse in 2021. Kate, go ahead. And I think you share your time with Stefan, that I will present in the meantime.
Great. Thanks to everybody speaking here, and thanks so much for having us. So we've been living and working under the so-called Swedish model for the past 4 years in the Republic of Ireland. And it's been extremely frustrating, of course, and has had disastrous outcomes. So like many other places where they've passed this client criminalization, it was it was merely extra criminalization as opposed to less. So it was always legal to work alone, but now our clients are criminalized, and they increased penalties for people working in pairs or groups. SWAY, and the end of them putting the bill through, we fought very hard to get an amendment passed that would decriminalize outdoor workers. So we managed to get that through, though that wasn't in the original intention of the bill. So what it has been like has basically now proponents of this law are trying to make it look as if it's been a success. They're working very hard to make it look like it's been a success. So, for example, we'll make one step forward, but in reality, we'll make 2 steps back. So I'll give you a few examples of how it's been like this for us. So we were reached by 3 sex workers who were raped by the same man. We were contacted by them, specifically our organization, because we're peer-led, because we're sex workers ourselves. So we managed to work with, to liaison with our, with the Gardaí, with the police forces here, and we managed to get this man locked up now, serving a 20-year sentence. So that was quite striking. But this is at the same time, we've seen this huge increase in violence, 92% increase in violence against us, while there's a near 20% decrease in the amount of people that want to make a report to Gardaí. So we have so many more reasons now to not want to talk to Gardaí. We have had one specific detective come to us, very proud of the rebranding. It was essentially a rebranding of the Vice Squad, the prostitution crackdown unit, telling us that they are going to be more sensitive about arresting people for brothel keeping, that if they can prove that people are working independently, they won't arrest them. But this is just an informal word. We don't know how it's going to play out if it's not set in stone. And this is at the same time that we're just off the back of a meeting with police, a group of police who are telling us about this new unit. They call it a protective unit, but telling us that it will come with 75 new officers to do crackdowns and raids, and even explicitly told us that they'll be continuing to take condoms as evidence. The last example of this is that, as I mentioned, SWAY managed to get decrim for outdoor workers. The Minister for Justice here has just started an initiative to expunge convictions for outdoor workers. We know how great that is, and we're very happy for that. But the majority of arrests and convictions are under these so-called brothel keeping laws, and there's no indication whatsoever that they will expunge these convictions or that they will repeal the law. So what we are always trying to say is that these changes need to happen culturally, but they in terms of respecting sex workers, in terms of people not suffering repercussions from the stigma of being a sex worker, but that it happens structurally, that when police forces come to us and say they want to work with us so much, we say we want to work with you as well as much as we can. We realize that you are tasked with enforcing this law. And if we had decriminalization, it would remove these barriers, etc. So I want to give you one quote because my time might be up. Oh, can I just give one little quote here? And it's from the report that I'll let Stephen talk about. And it's a woman who was stealthed at work, a migrant sex worker. She says, well, when that thing happened to me, I was afraid. I didn't go to the police because I didn't know the consequences, so I preferred to stay at home. The next day I went to the health center. I was waiting to receive help, but I didn't. But maybe if I start to say what I'm doing and people won't judge it, it could be better. But it's society. We can't change their minds or the way they think about us. But I really don't know what is better now. I just want to have the support now to the community and then to the institutions and then the police. And she went on to describe how she wasn't given PEP because she was afraid to tell them that she was a sex worker. They merely saw a cis female, told her she wasn't high risk, and so she was left like that. We received a wealth of information and great stories from the research that I'll let Stephen talk about now.
Thank you, Kate. And yeah, I'm sorry to hear all those stories still. Stephen, so you are the executive director of HIV Ireland. So I'll let you talk about the report you did together with Sway.
Thanks. I'll only be a couple of minutes on this. But I suppose towards the end of the summer last year, round about the time the COVID-19 pandemic had subsided in Ireland for the first time and things were looking back, sort of like getting back to normal perhaps, we published this report with Sway, with the Irish Sex Workers Research Network, of which Sway is running, and with researchers from Maynooth University. And it was examining the lives and experiences of sex workers following the enactment of this law, the Criminal Law Sexual Offences Act 2017, which basically codifies the Nordic model and the prohibition on the purchase of sex into Irish law. So the research underpinning the report was drawn from evidence provided directly by sex workers. So they spoke directly to our research team, cis, trans and non-binary sex workers, those born outside of Ireland and those born in Ireland. And really our motivation in partnering on this study was to understand firsthand how the rights of sex workers, which is a key population in HIV prevention, was being impacted by this law and what reforms might be needed. So the findings from the research are really valuable, and we can share a link to that. I think somebody did. I think Kate just did that. Really, I suppose the first thing to say is the research uncovered a very vocal, dynamic, enigmatic cohort of respondents, who the sex workers who participated in the research, who were engaging in sex work for various reasons and various capacities, and really there was little, if any, conformity to the narratives or tropes about sex workers as victims of trafficking or some people who are coerced. That wasn't the cohort of people that we met and who spoke to us. Really, we think we got a good sense of the sex work community in Ireland. The findings suggest that sex workers are, in fact, the best arbiters when it comes to decisions about their own healthcare needs, including prophylactic interventions for HIV and STIs, access to justice issues around inclusion and other concerns. And it is really the voices of sex workers that we need to be, policymakers need to be listening. So barriers to accessing healthcare were numerous, but rarely related to the actions of sex workers, but to the systemic issues within which the sort of sex workers encountered the health services, or the structural violence, as the report describes, that sex workers experience. I think, though not captured in the research, all of this has been further compounded by this global pandemic. And I always say, at the moment, we can't talk about HIV and HIV prevention or really any aspect of sort of social care and access rate without talking about COVID. And we need to name it. And it's working particularly hard in Ireland over the past 12 and 13 months. And we know this. But among the many interesting findings was the desire expressed by sex workers to see greater peer-led health initiatives. And that I particularly mean at the community level. HIV Ireland has had really considerable success in driving peer-led community health initiatives among gay, bisexual and men who have sex with men. And that would include migrant communities of gay men engaged in sex work. But largely towards the GBS MSM community, we've had great success. And I'm sorry if my connection is unstable, so let me know if you can't hear. And that is the model that we think, we should draw out in relation to peer-led health services for sex workers. And that model relies very much in peer and volunteer engagement, And as a strategic approach, as I say, it's very successful. So to wrap up, the same approach can and should be adopted in providing access to healthcare for sex workers. Sex workers, it was found, often experience being dismissed or discriminated against, as Kate highlighted, by, in fact, healthcare professionals. They're excluded from policy decisions, such as the rules governing access to PrEP are not designed really with sex workers in mind. And so it makes sense for sex workers to play a more active role in the strategic approaches to HIV and STI prevention. And I'll finish by saying that reform of the law, of the Criminal Law Sexual Offences Act, it really is a priority for HIV Ireland. It goes to the heart of what UNAIDS Chief Winnie Byanyima said the other day when she said, we need to get the global response to AIDS back on track. So we need to, one, put people first. We need to, two, end social injustices. And this is really where sex workers are very experienced. And three, we need to ensure the right to health, access to the right to health. And we don't have that in Ireland in relation to sex workers yet. There have been steps forward, but as Kate says, they're often met by taking a couple of steps back. So each of those pillars that I've outlined there, that Winnie outlined, do directly impact on the lives of sex workers in Ireland, and they should be prioritised. So thank you very much for listening.
Thank you, Stefan. And also thank you for showing us that, the findings of the reports, but also showing us that it is possible to have collaborative research between HIV organizations and sex worker-led organizations. As Luca wrote in the chat, we really encourage more HIV organizations to include sex workers in research and data collection. So now we're gonna go to France, and we're gonna hear Giovanna Rincon, who is a Colombian trans woman who is migrated and is based in France, and she's a former sex worker and the director of the organization ICRSE. Giovanna will be speaking in French, so maybe, Giovanna, we do a small test at the beginning. I think you have to be in the French room and everyone else has to be in the English room.
Merci beaucoup. Donc, rapidement, ICRSE est une association qui a été fondée en 2010 à Paris par des femmes trans, la plupart concernées par le VIH, par le travail du sexe et par l'immigration. Cette association a su mettre en place un dispositif complet, une prise en charge générale des personnes trans les plus touchées par l'intersectionnalité de ces sujets. Aujourd'hui, après 10 ans, nous avons concrétisé une offre globale qui a plusieurs pôles. Le premier, c'est le pôle santé et prévention. Le deuxième, c'est le pôle social qui accompagne dans son ensemble les personnes trans. Et ce pôle s'associe intégralement au pôle santé et prévention. Un troisième pôle qui est le pôle juridique qui relève aussi l'accompagnement.
Giovanna, juste 2 secondes, en fait, ça marche pas.
So she was talking about ICRSE, our organization that was founded in 2010 by trans women living with HIV who are also concerned with by sex work and immigration. So they offer a comprehensive service, different services for people who are at the intersection of all these different identities and oppression. What she can say is that after 10 years of organizing with ICRSE, they have a global offer that includes different pools. The first one is the health pool that provides services, and the second one is a social for social services that is also linked with the healthcare services that we provide, and the third one is about paralegal support.
Ce projet actuellement d'ICRSE offre aussi donc tout un accompagnement juridique qui permet effectivement d'accompagner toutes les victimes des violences transphobes.
So the current project on the paralegal support helps to provide support to trans women who were victims of violence. C'est bon, tu peux y aller.
Je vais continuer. Je ne sais plus quoi faire en fait.
I think the problem is that she can't hear me.
Donc, je vais plutôt centrer ma présentation sur ce qui est le dispositif pôle prévention santé dans notre association. Pratiquement, à ce jour, nous offrons la possibilité de faire du dépistage rapide du VIH, l'hépatite C, la syphilis et aussi l'hépatite B directement dans les locaux de notre association qui est ouvert. C'est un lieu d'accueil du lundi au jeudi. Nous avons aussi un psychologue qui est présent lors d'une permanence tous les lundis qui permet de filtrer et d'accueillir les personnes qui vont arriver pour la première fois à Paris. La plupart, évidemment, ce sont des personnes trans, travailleuses du sexe, qui sont en situation d'immigration, du passage et de mobilité. On a un psychologue aussi qui est tous les lundis dans la permanence centrale où il y a aussi la présence d'un médecin qui vient d'un hôpital public avec lequel nous avons un partenariat. Le lundi, nous avons aussi la possibilité d'offrir un espace de convivialité et un espace de réponse aux besoins matériels, notamment en matière d'hébergement et en matière de nourriture pour les personnes. Aujourd'hui, ceci est possible après avoir créé le Fonds d'action sociale trans qui récolte des fonds depuis mars de l'année dernière et qui permet effectivement de s'associer à ce pôle santé et dans l'ensemble des projets de l'association pour répondre aux besoins des précarités des personnes que nous accompagnons.
Et si on peut s'arrêter là, parce que ça avait beaucoup à traduire là.
Le pôle santé prévention a développé une offre de dépistage et d'accompagnement vers la prévention combinée hors les murs. C'est-à-dire, on a une équipe de 4 médiatrices en santé salariées et un coordinateur du pôle qui ont développé avant les crises de Covid toute une stratégie pour aller à offrir du dépistage et la promotion de la prévention combinée lors des soirées comme libertines ou sinon aussi dans les saunas et dans plusieurs lieux où il y a du sexe tarifé ou non.
Giovanna, et Thierry va traduire parce que on peut pas faire en simultané, donc il faut qu'il attende que tu aies fini.
Yes. Okay. So, so she was talking about the different pools. She will focus on the health pool for this conference. So the organization provides services on HIV, hepatitis C and B, and also syphilis. So especially in terms of testing, and they do provide screening testing services in their own premise of the organization premise in Paris, which is open from Monday to Thursday every week. On Monday, every Monday, there's a mental health therapist, psychologist, who welcomes people who arrive, who may be newly arrived in Paris. They provide a space for conviviality, a safe space for people to share their experiences and talk about their needs, especially material needs in the current situation, in terms of housing and also food, access to food also. So that's the reason why in March, not this March, but last year, so for a bit more than a year now, the organization has launched a specific fund, which is called Fonds Action Sociale Trans, so social action fund for trans people, that helps to provide this social support in terms of food and accommodation. Otherwise, in terms of the usual testing offer, it's part of combined prevention action which is done. The expression is hors les murs, which means outdoor prevention. So they go to sex parties, to saunas, to any places where it is known that sex work happens, knowing that it's increasingly difficult to identify the different sex work scenes that have been displayed due to the criminalisation. C'est bon.
Giovanna, tu peux continuer. Et vous avez encore, tu as encore 2-3 minutes.
OK. Après la crise Covid, nous avons dû réinventer les stratégies d'offres de prévention et de dépistage. Et nous avons passé à l'attaque sur la prévention en ligne qui a donné des résultats assez spectaculaires puisque nous avons réussi à envoyer à ce jour par colis, par la poste, au moins 400 colis avec des autotests du VIH directement au domicile des personnes trans, travailleuses du sexe et autres. Et à ce jour, nous avons réussi à faire dépister au moins 200 personnes qui se sont autodépistées dans leur domicile et qu'on a eu 3 résultats positifs avec une possibilité que les médiatrices à distance puissent continuer à faire accompagner et faire accéder aux dispositifs de prévention combinés les personnes, soit pour la PrEP, mais soit aussi par rapport au VIH et les autres infections sexuellement transmissibles. Une chose qui nous paraît importante à ce stade, c'est de comprendre un peu la notion qui devient de plus en plus difficile suite à plusieurs réformes législatives et à la crise de Covid, c'est en termes du VIH, la notion d'observance. Quel type d'observance et comment tout ce contexte va impacter négativement l'offre, notre offre en termes de prévention, mais aussi en termes d'observance pour les personnes à niveau thérapeutique. Nous nous posons beaucoup de questions aussi sur un sujet, parce qu'on parle du VIH, c'est-à-dire la normalisation de la contamination du VIH à l'intérieur des communautés trans, et notamment à l'intérieur des communautés trans les plus impactées par la classe sociale. Donc, nous savons aussi que la notion de qualité de vie, qualité de soins est très peu considérée quand il s'agit de parler de stratégie de santé publique. Et un sujet qui nous paraît extrêmement fondamental à mettre en avant, c'est que notre stratégie qui a été développée ces dernières années, aujourd'hui, répond totalement aux stratégies de santé publique et à niveau international sur les recommandations, et notamment ce qui concerne les réductions des délais. Nous avons, avec notre stratégie, démontré qu'on peut arriver à 0, c'est-à-dire dépister, accompagner vers le soin, efficacité des traitements, mais que tout le contexte que je viens d'évoquer en termes législatifs et en termes d'épidémie impacte négativement, sans que pourtant les politiques et les institutions ont souci en réalité de ces problématiques. Je voulais finir pour dire que notre stratégie est aujourd'hui très appréciée. Les données que nous avons commencent à être vraiment considérées par toutes les instances de santé publique et autres, et que nous avons réussi avec notre stratégie qui a commencé avec 0 argent, aujourd'hui avoir 12 salariés, dont 11 personnes, nous sommes toutes des personnes trans issues de réalité de l'intersectionnalité, ce qui a provoqué vraiment un changement de paradigme vrai sur toutes les questions des capacités à développer une déontologie des savoirs communautaires en faveur de la santé publique en général, et qu'aujourd'hui, nous avons réussi à démontrer que nous ne sommes pas objets de santé publique, mais des sujets des savoirs en faveur de la lutte contre le sida et de la lutte contre les inégalités.
Okay. Yes. So after the COVID crisis, we had to reinvent our offer for testing and prevention. So we developed online prevention. We delivered 400 parcels that included self-testing for HIV to trans sex workers people. So through that online prevention and the delivery of all the self-tests, 200 people were able to test themselves at home, and we managed to identify 3 positive results, so HIV positive results, and these 3 people were able to be accompanied by peer worker despite the distance, but to access then treatment and care as it is usually done before that situation. So mainly the access to treatment offer is in ARV for people with HIV, but also PrEP for people who are negative, and also care for the other STIs. It's important also to understand the notion of observance. In the context of COVID, it has negatively impacted the good observance for treatment, and also we observe a form of normalization of HIV infections within trans people who are also socially defavorized. The quality of life is not really considered properly by the authorities, and so that remains a problem. We try to we follow all the international recommendations, and we think we have results to show that we can reduce the time periods to help people access to the different health services, and we believe we can achieve a 0 infection. But the problem is it's not possible to do it in the current context due to the legal barriers and structural operations. We believe our strategy is really appreciated by our communities and also by the medical authorities, because we are able to provide data, and the data we provide starts to be really respected. We remember when we started, I think 12 years ago, when they started ICRSE, they had nothing, like 0 fund. And today there are 12 people working for the organization, all trans people from different backgrounds at the intersection of different oppressed identities. And we managed to change the paradigm in terms of the community knowledge. We are now recognized and accepted. We are no longer objects of the research or the medical attention, but we became subject in the fight against HIV and for social and equality justice.
Thank you, Giovanna, and thank you, Thierry, for the translation. So it's 6:28 and it's almost the end, but we still have one speaker. We have Agata Jusban from Sex Work Polska, and after that, I would still really like to hear the conclusion of Luca about the report, and and after that, if you have the patience, maybe some time for questions. But first, let's hear Agata from Poland.
Hello, everyone. It's amazing to be here, and thank you for having us. I do speak here on behalf of Sex Work Polska, which is a sex worker-led community group from Poland. We exist for 7 years already, I think, but the group is dynamically changing and expanding in terms of different areas of our work. Since we don't have much time and I would like not to take as much time possible, I would like to leave the space for discussion. So I will highly encourage you to read the report, the briefing paper, which is published, being launched today, because it actually features Sex Work Polska as well. So you could learn a lot about our work from there. I just wanted to stress several things that I think are the most important for us in the contemporary context. So Sex Work Polska brings together sex workers from across different contexts, and all of us work for free. So this is I would say our voluntary work. We do it in our free time, which is kind of important because it shows very precarious circumstances in which we operate. We are not even able to register to have a legal identity in Poland due to fear of different forms of oppression, because this is something that a lot of NGOs, non-governmental organizations and associations are facing. Bless, Ben.
Sorry.
No, bless you. We work mostly in three different fields. So we try to create spaces in which sex workers can meet and get in touch with each other, exchange experiences and exchange knowledge, which is quite an important thing in the Polish context, because due to criminalisation of third parties and due to really high levels of stigma, a lot of sex workers are isolated and are not networking between each other and are not in touch. So we try to create this space in which sex workers can meet. We had a drop-in for a couple of years, but unfortunately, due to not really pleasant political situation in Poland, we've lost it at the very beginning of pandemic, but we were working on it. The other field of our work is outreach, and I guess that most of you who are here representing sex worker-led organizations do outreach yourself. So I guess we all know what it means, going to places where sex workers provide their services, and we go to outdoor settings, indoor settings. We work mostly around Warsaw, the capital, in private apartments, in brothels, in clubs, on the streets and on highways, with sex workers with different migrant background and different social backgrounds. And in response to the diversity of the community which we've worked, we also created a team of lawyers. So we cooperate with a team of lawyers. We have 5 lawyers who provide different legal advice and services to sex workers. Also, we cooperate with lawyers who are specialized in the context of migration to help regularize stay for a lot of migrant sex workers with whom we work. We have psychologists. We also have accountants working with us for people who work mostly through the internet in strip clubs and perform work and the cameras, coming services. And we work with traumatologists and with psychologists, and all that we kind of provide within the context of our outreach work. And the third field of our work would be advocacy, which is increasingly difficult in Poland because we are navigating very increasingly hostile environment, I would say, currently. And it's not only due to Corona, of course, which affected and vulnerabilized sex workers' communities a lot, because, of course, as in other countries, as in Macedonia, for example, as Lila was saying, sex workers were not protected by any kind of anti-crisis government-run programs and projects, because sexual labor is not recognized as labor, and sex workers' labor relations and workplaces are being criminalized. So sex workers have been entirely excluded from any kind of support, have been, we would say, institutionally abandoned and invisibilized in the context of the COVID response. so that we had to, as many other sex worker-led organizations across Europe and globally, created our own form of support. We created emergency fund for sex workers. We collected money, and we still do it. And we have supported by now 270 sex workers with direct money transfers. But in the context of Corona, we have also paid. We have also helped people with buying laptops, for example, for their children due to remote learning. We have facilitated access to housing, or we have rented houses. We have facilitated access to different health specialists. And I just wanted to say that I think that the streaming window, no, it doesn't, sorry. Which is very important because sex workers in Poland are not recognized as workers, so they don't have access to insurance. So many of them are left out of the healthcare system, the public healthcare system, and they have to resort to private healthcare, which is very expensive in Poland. And the public healthcare system actually is at the verge of collapsing, I think, due to Corona. So if you are facing HIV or any other health concerns, you actually have very little chance to be attended in a public healthcare setting right now. So all the operations, cancer-related, etc., are postponed because we are facing really high levels of Corona right now. But except for pandemic, except for Corona, except for the criminalization of sex work and very carceral approach to sex work in Poland, and very harsh policing, which is related to pandemic as well, because we have seen sex workers being really dramatically targeted by the police over the pandemic and being fined with exorbitant fines for being out there. We also have seen situations in which people are waiting in line for methadone clinics have been fined for participating in illegal assemblies. And right now we are trying to cover the fines that people gathered over the pandemic and were not able to pay back because they couldn't work, because there was no work. So I would say the pandemic-related situation is quite traumatic in Poland, but we also have Poland in itself. So probably you have heard that Poland is going into some quite awkward political direction over the last years. So we have a really increased rate of state-sponsor homophobia with LGBT-free zones and legislation which is hampering LGBTQ communities. We have ban on abortion almost entire, which was introduced only recently. And for the context of HIV, I think it's very important to mention, yes, I see I should finish, this is what I do, that using the COVID pandemic as an excuse in a way, and the introduction of the anti-crisis shield, so-called, in March last year, our government has increased criminalization of HIV. And right now, HIV exposure is criminalized up to 8 years. So as you could see, and it's actually a very new development from last year, which didn't really attract much of an attention in Poland from the media and even organizations that work in the field of HIV, which is, I think, quite surprising. So we can see that Poland is going against all rights-oriented and science-oriented and science-based approaches. And this is worrying, but we still try to survive. Thank you.
Thank you, Agata. And yeah, it's very sad to hear that this is a situation in Poland. Maybe we're going to finish now with Luca presenting the recommendation of the reports. Luca, go ahead.
So hi.
Luca is the coordinator of ICRSE.
Hi, everyone. Thank you so much for staying a bit longer, and apologies for the technical issues. So today we are launching a report. It's actually an advocacy tool that has 4 parts. I have a quick presentation that I will share now with my screen. Hopefully it works. Yep, so we published this report today, and it was developed in partnership with the European AIDS Treatment Group. And as part of the European Red Umbrella Academy sex work and HIV training program, which we developed this year and which included a training for 25 sex workers and HIV activists from 8 countries. We decided to develop this report because despite many progress when it comes to HIV prevention in the region, sex workers continue to be mainly excluded from it. So the first part is a briefing paper called One Step Forward, Two Steps Back. It will also be available in French, Spanish, and Russian soon. And it looks at the data and evidence. And actually, one of the main issues is that we lack data and evidence when it comes to HIV, partly because the governments are not taking community data, for example, or that often sex workers are afraid to mention that they are sex workers to service providers. Also, what we think is really important is to note that sex workers belong to various groups such as trans people, MSM, men who have sex with men, migrants, undocumented migrants, people who use drugs, etc. So often the data is flawed and don't represent the variety of like sex workers' lives. The report also looked at the impact of criminalisation, with a focus as well on the criminalisation of clients that both Kate and Giovanna mentioned, stigma, discrimination and violence, and the impact on precarity. As was mentioned by several people already, one of the key issues is that many sex workers are migrants and undocumented migrants. We know that between 3.9 and 4.9 million undocumented migrants live in Europe, and that an estimated 44% of all new HIV infection is recorded among migrants. Sorry, just have a little. And that the proportion of migrants among all new HIV recorded cases vary greatly, with Sweden, for example, recording 75% of new cases amongst migrants. But we don't have any data when it comes to migrant sex workers in Sweden, partly because of the political landscape where sex workers and their organization are not recognized as partners. There is very limited data regarding HIV prevalence amongst migrant sex workers, but in countries where there are such statistics, we know that there is higher levels of HIV prevalence, with Portugal, for example, that has an HIV prevalence among undocumented female migrant sex workers of 13.6% compared to 8% among domestic sex workers. One of the key issues in the region is, of course, the criminalization of clients, with Sweden, Norway, France, Ireland, Northern Ireland, etc., criminalizing clients now. And we know, for example, in France, that the number of HIV contamination has increased thanks to the work of ICRSE that Giovanna was mentioning. And that in 2015, for example, newly tested trans people represented 0.1% of cases, and this went up to 7.4% in 2017. And I think that's really what we wanted to highlight with the work of Giovanna and all the organization, is that our community know the reality of the epidemic, and they need to be included in a conversation with government and health institutions. This you've probably seen before, but the report also look at the current evidence at the global level. And this is one of the key data, the key information, the key research that we use in our advocacy. And it's research by the London School of Hygiene and Tropical Medicine. It's a meta-analysis that look at 40 quantitative and 94 qualitative studies over 30 years between 1990 and 2018, and 33 countries. It's the biggest meta-analysis of all evidence regarding sex work and health. And the evidence is there that 3 times that sex workers that express that sorry, I'm trying to be too fast. That sex workers that face repressive policing, including arrest and imprisonment, including the Swedish model, are 3 times more likely to experience sexual or physical violence, and twice as likely to have HIV or another STI, and 1.5 times more likely to engage in sex without condoms with clients. And this is one of the key outcomes of the criminalization of clients, is because the number of clients decrease, sex workers still need to continue to work and are more likely to engage in sex without condom to make the same amount of money, to pay for rent, to pay for food, etc. The second and the third part focus on community-led services. There is one part with key definition from a different document, such as the SWIT, the Sex Worker Implementation Tool, NSWP and SWAN, our colleague partner in Eastern Europe and Central Asia. And the third paper is the case study of community-led services, which focus on Umbrella Lane in Scotland, Star, North Macedonia, and Sex for Polska in Poland. So you heard from like 2 of this organizations. So I invite you to read the document and learn of the work they are doing. And to end, this is part of the recommendations. There are more recommendations to different institutions, but of course, our recommendation is that sex work must be decriminalized. And this is really the priority that our organization are advocating for. Until sex work is decriminalized, we will be more at risk of HIV contamination. We will be more at risk of precarity, violence, etc., as been proven by so much academic and community evidence. We also are calling for the implementation of a firewall between immigration authorities and health services. Until then, undocumented migrants will be unlikely to report violence to them and to access health services. Violence and addressing violence against sex workers is also a key priority. Recognition of sex work as work and the support for the self-organization and unionization of sex workers. We also call for the meaningful involvement of sex workers. We know that sex workers should be involved in the development, the implementation, and the evaluation of services and policies that concern them. And that sex workers should be included, like in North Macedonia, in the development and the implementation of HIV national action plans. Finally, we really strongly encourage government, institutions, funders to financially support sex worker-led organizations and community services. Most sex worker organizations are really functioning with almost no funding. The report looks at, for example, the work that Sex Work Polska is doing, which is life-saving work and is done without any funding. And finally, that governments should support the implementation of the UN/AIDS strategy. So I really recommend you to download the report, have a read, contact us if you have any questions. And thanks again, everyone, for staying so long. And thanks to all the speakers for participating.
Thank you, Luca. Do we keep time for some questions? Maybe if there are any questions from the audience? You can raise your hands, unmute yourself. You can write it down in the chat as well. Yes, someone is asking if we can have Luca's presentation available. Maybe you can put a link, Luca. Yes, thank you. Anyone else with questions? It seems not really. So we're gonna. No, yeah, there is a question from Ben Collins. So, Luca, in your slides, you said that sex workers in repressive situations were 3 times more likely than whom?
Yes, so sex workers who are facing repressive policing, such as fine or arrest, are 3 times more likely than sex workers who are not facing, so in like decriminalized context or non-criminalized context.
Thank you, Luca.
But if I can end maybe just with a few words of hope, because I think we often focus on the negative, which is important for sex workers. But what we've seen as well with COVID crisis is that some governments are starting to realize that it is not possible to continue to exclude sex workers, and that it's really important to include sex workers in response to COVID, but in response to public health, in response to exploitation, etc. So, for example, we're looking at Malta, which is looking at the decriminalization of sex work. Belgium has now announced that they will be looking as well at, moving forward with legal reform. I hear that other countries are also going into this direction. So it's been 20 years of Swedish model and criminalization of sex work in Europe, which is really problematic for our region, but is also being exported internationally. We're hearing like Ukraine discussing about criminalization of clients. And a key issue with criminalization of clients is the impact of policing. There is now this really reckoning of violent police forces against marginalized communities, like Black Lives Matter, defunding the police. These are already important movements that are also in line with sex workers' demand. And I think we need to ally with all these other organizations, all these other movements to really call for a decriminalization approach to sex work, evidence-based policies, so that sex workers stop being such vulnerable community. So that was my little point to close this and wish everyone a happy day, evening, and happy weekend. Thank you very much.
Thank you. Bye, everyone.
Thank you. Enjoy your evening. Bye.
Thank you. Thanks so much.
And thank you from Poland as well.
Thanks so much.
Thank you.